Okay, so I'm going to check the doctor's orders. I'm going to perform hand hygiene, gather any supplies I need. I'm going to secure privacy. Hi, I'm Brooke. I'm your student nurse today. I'm going to identify the patient with 2 identifiers. Can I get your name and your last name?
Angel Raccoon,
And your date of birth?
9/11/1990.
Okay. So today I'm going to perform a partial head-to-toe assessment. I'm going to ask you some questions, and then I'm going to observe myself.
Okay.
Okay, so do you have a sense of smell?
Yes.
Okay, I just assessed cranial nerve number 1. Okay, can you follow my pen light without moving your head? Okay, and then go ahead and look behind me, and then look at my pen light. Okay, next I'm going to measure the pupils. They're about a 4. And then go ahead and just stay still and look forward. Okay. The pupils are equal, round, react to light, and accommodation. I just assessed cranial nerves number 3, 4, and 6. Can you open your mouth and close it for me? Okay. I just assessed cranial nerve number 5. There was no clicking. The jaw closed smoothly. Okay, can you raise your eyebrows for me? What about puff out your cheeks? Can you smile? Okay, I just assessed cranial nerve number 7. The smile was equal bilaterally. Can you, if the patient was having any vision problems, I would assess the Snellen's chart, which is assessing cranial nerve number 2. If the patient was having any hearing problems, I would assess or do the whisper test, which is cranial nerve number 8. Can you stick out your tongue for me? Okay. Can you say ah?
Ah.
Okay. Can you, the uvula raises midline, the tongue sticks out straight, I'm going to perform the gag test, the gag reflex test, and I just assessed cranial nerves number 9, 10, and 12. Can you raise your arms for me, your shoulders? Good job. Okay, the patient shows resistance. I just assessed cranial nerve number 11. Okay. Have you had any headaches?
No.
Any dizziness?
No.
Have you had any surgeries on the head? Okay. Have you had full range of motion? Any problems with the neck?
No.
Okay. As I'm looking at her head, I do not see any lice. I do not see any lesions. Her hair looks clean. Do you feel any tenderness?
No.
Okay. Her head is appropriate for her size. Her head is round in shape. I'm going to look at her eyes next. Have you had any tearing of the eyes? Okay. Any pain, redness, or swelling? Okay. So the conjunctiva is pink and moist. The sclera is white, and the cornea has no opacities. The eyelashes are evenly distributed. And the eyebrows are as well evenly distributed. Now I'm going to look at the nose. Can you tell me, have you had any discharge on your nose? Okay. Have you had any pain? Any nose surgeries? Okay. So go ahead and lift up your nose. Okay. It is pink and moist. There's no perforations, and there's no deviations. Any tenderness? Okay. Go ahead and turn for me. I'm going to look at the ear. Have you had any earaches?
No.
Any dizziness?
No.
Any ear surgeries? Any tubes in your ears? Okay. Any discharge?
No.
Okay. So I'm going to look at the ears. I do not see any discharge or any foreign objects. Do you feel any tenderness when I'm pulling?
No.
What about when I'm pulling down here?
No.
Okay, what about when I'm squeezing, pinching right here?
No.
No? Okay. Now I'm going to look in the mouth. Okay. The buccal mucosa, is pink and moist. The teeth are clean. I just see a couple fillings. The pharyngeal wall is pink and moist. The tonsils are about a 1+. The teeth are intact. The hard and soft palate are intact. Can you stick your tongue from side to side? Okay. There are no sores or lesions. Can you smile for me? Okay, the gums are not bleeding. They are pink. Can you, or actually, this, I'm just going to feel for the temporal artery. It's about a 2+ because it's not weak or bounding. Have you had any bleeding of the gums?
No.
How often do you brush your teeth?
Twice a day.
Do you floss?
Yes.
Okay. I'm going to feel for the lymph nodes. So I have the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, submental, postcervicular, supracervicular or superior cervicular, the supraclavicular, and the deep cervical. And I have just assessed, I have just finished my partial head and neck assessment.